Okay, yeah. So I'm a consultant clinical psychologist and teacher at Jamia Khatam al-Nabiyyin. And I'll talk a bit about Ihsan further on in the presentation as well, in terms of getting an idea of where to refer people with significant obsessive compulsive disorder difficulties or managing waswasa. Yeah, so we're going to talk a bit about understanding distressing thoughts and whispers of the shaitan. What do we mean by that? And then what do we mean by when we say OCD? Because sometimes in general conversation, people, in terms of OCD, a lot of people say, oh, well, that person's a bit OCD, that person's got OCD, and it might refer to sort of some low level, somebody who's really clean and wants things to be in the right place a bit. So, so I'll explore that in a bit more and talk about diagnostic criteria and thinking about the level of distress before we would consider something to be what we would refer to as clinically significant difficulties. Because it's a community webinar, I'm going to take like a community psychology approach. I'm going to talk about some things that, inshallah, everybody can take away with them. Obviously, because this is a webinar that is particularly for the Muslim, it's for the Muslim population, and obviously there might be some non-Muslim joining us, but we will focus a bit more on like religious expressions of OCD, and that's not specific to Muslims only. There might be some Christians who also have like blasphemous thoughts when they go to the church and things. But so we will sort of focus some of our discussions, and Mufti Sahib further on will focus some of the discussions from a religious perspective. Because distressing thoughts are something that impacts on all of us, there'll be some sort of more general discussions and thinking about how we can sort of help ourselves and also others. So alhamdulillah, as you know, it's a Sunday afternoon, and mashallah, you guys have taken your time out to be here with us today. So obviously from that, I can gather that you guys have got an interest in supporting people with OCD. You probably have supported people with OCD in the past, or people finding it difficult. You might have worked in as a professional, as a psychological therapy professional. You might work in a mosque madrasa. So I'll sort of think about how you can, what we call in psychology, just formulate the problem a bit more widely and think about how best to support somebody or how best to signpost somebody in the right direction for help. So we'll talk a bit about specialist referral, both in terms of like NHS referral, as well as, for example, with Ihsan as a specialist Islamic provider of psychological therapy. And then we'll take a break for 10 minutes, and then Mufti Abdul Wahid will do his presentation, and I will talk a bit about some of the things that Mufti Abdul Wahid might expand on in his presentation. So understanding distressing thoughts and compulsions. So when we think about waswasa, we are sort of thinking about something that's in more of the what we call the cognitive domain. In terms of when we think about waswasa, we're thinking about the thoughts that we generally get in our minds, and sometimes these thoughts might just be about what we're working on. There might be negative thoughts, there might be positive thoughts, but when we're talking about whispers of the shaitan, we're not talking of an external experience. So sometimes in mental health, we do have people who have like an external voice, and that could be a strong, accentuated inner voice due to past significant trauma, and there's some disassociation associated with that. It can also be what is more commonly understood in the community is when somebody says they can hear a jinn, so they can hear an external voice, and that voice of the shaitan. We're generally talking and not at the extreme level. We're talking about the general sort of thoughts that we get in our head that are negative, and we all get these sort of negative thoughts. Some of them can be attributed to shaitan, or they could be attributed to the people around us and the way they have conversations with us, and shaitan could then play a role within that complex dynamic. But we are talking about that sort of general level of sort of thought process level. So if sometimes you're talking to a friend and he's going through some difficulty, he might say, or he might talk about all these negative thoughts that he's having, and you might just say to him, or there was of the shaitan, just sort of yeah, just ignore them, move on. So at some level we all experience this waswasa and these negative thoughts, but for some people they can get extremely distressing and strong. And at this point, sometimes we might then move away uh, from it being a normal experience to manage to something that's more complicated and might fall within a disorder. And sometimes when people experience these distressing thoughts, they might then do something to neutralize or to manage these thoughts. And some of these things can be at a sort of mind level, where the person's trying to suppress the thoughts, or they could then do something, for example, to stop themselves uh, uh, from thinking that. So, and people can commonly have these at a lower level. So, checking windows or repeating a unit of prayer is something that happens to a lot of us. But when it comes to OCD, it's at a higher level. So, in some ways, most mental health disorders can often be seen on a spectrum. So, for example, depression, we all have periods of low mood, uh, periods of high mood. But if somebody then has significant periods of low mood, they might then be considered as somebody that falls within a depression criteria. Most mental health difficulties, apart from some of the more complicated ones, tend to be on a spectrum, and we all experience certain aspects of these. And I think OCD is one of them where we might all experience some level of this difficulty, but it's not at a significant level where it's impacting significantly on our life. Uh, and at some level, sometimes it's quite difficult. Sometimes it's not always useful to like diagnose difficulties. So, for example, there's a lot of debate in terms of like children and mental health, and the rates of estimated mental health difficulties in children are seem to be quite high at the moment. But at some level, there could be some critique of this, because in some ways all children are going to go through some level of adversity as they grow up. And to a certain extent, some of this is quite normal, and it's important for them to like build their resilience. And by medicalizing this or diagnosing children can sometimes be unhelpful. Similarly, for some adults, if you diagnose somebody, they can go down the sort of illness narrative and not seek help or coping strategies to move on from their difficulties. They could get trapped in the benefit system, or there can be an over medicalization. For example, in schizophrenia in the past, particularly, there's been an over medicalization, which can be unhelpful. And when we're thinking about OCD, sometimes when people are looking at a person and what difficulty they've got. Sometimes OCD is sometimes better known to people, or it stands out. And to when a professional is seeing somebody and looking at OCD, one of the things we talk about is like differential diagnosis. So trying to look at the person and think about, is there anything else that accounts for their difficulty? So as we know, people with autism, for example, they may engage in repetitive behaviors. They might have uh, patterned ways of thinking, and some of this can be quite similar to OCD. So, for example, I worked in a learning disability service, and one of our uh, purposes of our service was to do an assessment and to diagnose if the person had a learning disability or whether they had autism. Learning disabilities, autism often co-occur uh, in 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 populations. So, and sometimes we have young people coming in where their difficulties were conceptualized as being an obsessive compulsive disorder, and they were giving cognitive behavior therapy. They were looked at from an anxiety disorder lens by professionals, teachers, but on a more careful consideration of their difficulties, it's quite clear that young girl, now an adult, her difficulties, when you explored it further, were better understood as being uh, an autism diagnosis as opposed to an OCD. And so, for example, with OCD, there might be an element of that we have this difficulty and we need to then treat that. And with autism, there might be some strategies of cognitive behavior therapy that might be helpful. But an autism is a neurodevelopmental disorder. And in essence, if somebody has autism, they have autism for the rest of their life. So the way we manage that person's OCD behaviors in inverted commas or their repetitive behaviors is quite different. It's more of an acceptance that this person is like this, and we need to support how we can work around that person and how we can change the environment to support that person. Also, in people after a stroke or a brain injury, some of that can mimic OCD. So, so sometimes people in the community might think or the parents might think it's an OCD, but sometimes it is not we wouldn't consider it as OCD because their difficulties are better understood by a different method of a different disorder better explains their difficulty. The other thing to mention is I had a case, Zaid, and the parents referred to Ihsan, although the child was now an adult. So, and in Ihsan we only see adults at the moment, although we provide consultation to children. So when the parents made the referral, a lot of the referral talked about OCD, and they were really concerned about this OCD. But it was quite obvious from the first assessment that this wasn't the most important thing to work on, and his OCD, which I'll explain in the next slide, wasn't actually clinically significant, and we wouldn't even regard it as an OCD. And his bigger problems were of depression, and we needed to work on the depression to support the person to move forwards and think about his career options. Because of COVID, he took a year out and he didn't look into his apprenticeship, he didn't look into university. And in essence, focusing on his depression, increasing his activities, supporting him to go to the masjid. Post-COVID, a lot of people started avoiding going to the masjid, supporting him to look at his career options again, was the best way forward. And then it was to support the parents to understand that OCD is not necessarily a big factor here. Okay, so I'm not going to go through the sort of diagnostic criteria of obsessive compulsive disorder. I'm just going to mention some sort of summary points here that I've mentioned over here. There's at the bottom I put there's a manual. I don't know if you can see this, but there's a manual for diagnosis used by professionals. So this is the Diagnostic and Statistical Manual of Mental Disorders, version 5, and in here it's got a so this is like an encyclopedia of different mental health difficulties and obsessive compulsive disorders mentioned there. So obsessive compulsive disorder is a common mental health condition where a person has obsessive thoughts and compulsive behaviors. It can be a useful diagnosis to understand when distressing thoughts, compulsions become very strong and interferes with life significantly. So this is quite important. So on the diagnostic criteria, if I just look at it, it says the obsessions or compulsions are time consuming. For example, take more than 1 hour per day or cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. So it's got to be clinically significant. So, for example, somebody needs to wash repetitively in wudu. So in an OCD situation, some people are taking an hour to do wudu. They've only got one toilet in the house. Other people are waiting to use the bathroom. So it's causing quite clinically significant symptoms. An obsession is an unwanted and unpleasant thought, image, or urge that repeatedly enters your mind, causing feelings of anxiety, disgust, or unease. So, for example, thoughts of doing a bad act. So, for example, I've worked with patients, Muslim, non-Muslim, who have thoughts that they might do something violent to somebody in the street and they're worried about that, or they might sexually abuse somebody, and then it's quite difficult for them to utter these words. Similarly, we have people who come to us with difficulties that they are losing their iman because they're having kufr type thoughts. We have people who are married and are really concerned that by saying the word talaq, that they might divorce their wife, for example, and they're worried about that. So a compulsion is a repetitive behavior or mental act that you feel you need to do to temporarily relieve the unpleasant feelings brought on by the obsessive thoughts. So, for example, somebody who fears that they're going to utter the word talaq, they might then bite their tongue and hold their tongue. They might avoid interactions with their wife because of that. They might seek reassurance from Imam Sab, so they might constantly ring Imam Sab up and say, I'm having these thoughts, and Imam Sab will say, no, don't read their thoughts, they don't really mean anything. But particularly with in a lot of other religious traditions and in society, uh, 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 there's a misunderstanding. It's difficult for a non-Muslim professional to understand, for example, the talaq situation, because it's quite, I'm not sure about other religions and stuff, but in Islam, the verbal pronunciation of talaq by a male has a legal weight, and that's quite different from other religions and the law. So then that can make it quite difficult because people, when they're working with a professional that doesn't understand the rulings, it can make it very difficult. And then people find it very difficult to sort of say these words as well. Okay, and then I've given an example here. For example, someone with an obsessive fear of being burgled may feel they need to check all the windows and doors are locked several times before they can leave the house. So that's more of a sort of general example of somebody who's got OCD, and a lot of people are aware of these type of examples. Um, Okay, so there is a thought cognitive element, and there's also a behavioral component to it. But some of the compulsions, they can be within the mind as well. So say for example, somebody in the bottom example is worried about whether they've shut their windows and doors. They can then imagine that I've shut the windows and doors. So they could close their eyes before they go to sleep and imagine and to see themselves closing the windows and doors to remind themselves that they've done it. Similarly, a person who has repetitive recitation of their salah and has repeated their namaz, or is concerned their namaz is not valid, they may also like have a mental image where they are replaying their salah and reassuring themselves. But another thing they might actually do is then get somebody go to see their mom and ask him, have I prayed namaz, and get reassurance. Or they might ask Imam Sab a masala to clarify. So there might be some mental strategies and some behavioral strategies. And some of this is really difficult to unpick. So this is why obsessive compulsive disorder can be quite a difficult uh, thing to difficulty to work on. Okay. I thought I'll give you guys a bit of a chance to provide me with some sort of feedback, a bit of a flavor of your experience of this area. So, how have you helped people with distressing thoughts, those finding it difficult to manage whispers of the shaitan, those with OCD? What did you find helpful and what did you find difficult when helping that person? Okay, so if you type your feedback, I'll give you a few minutes, about 2, 3 minutes. So if you just type your feedback and I'll have a read of it as it comes through. Okay, so somebody's put something, face everything and recover. Okay, yeah, so that's interesting because, yes, because you need to, they say that you need to face your fears. If you fall off the horse, the best thing to do is get back on the horse as soon as you can. So, yes, there is that element of it, and we'll talk a bit about that. Okay, I found it very difficult in Umrah, and somebody talked about that they had distressing thoughts and found it very difficult. But one of the things that helped them is that they ignored the thoughts. So, so that word is quite useful, ignoring the thoughts. Okay, OCD wudu, okay, someone who keeps doing wudu. OCD usually attacks what we care about most. The fact that your fear, it means you don't actually want to do it in relation to the harm of OCD. So OCD attacks what we care about most. So yeah, so that's a good point. So what's the most important thing is our iman and preservation of iman. So the kufr thoughts are quite significant in terms of like distress because of that. And obviously, if someone loves their wife and then they have this OCD in terms of talaq, it can be extremely distressing. And we have known of cases when people have misdiagnosed this, or they've gone to an imam where the imam wasn't really understanding of his OCD difficulties, that then this OCD then led to a psychosis because obviously uh, this difficulty was affecting his relationship with his wife. Okay. Okay. So practically making to-do lists that can be physically ticked off, which acts like reassurance. Okay. So somebody's put here practically making to-do lists that can be physically ticked off, which acts like reassurance. So some of these strategies that like that strategy, it can be quite helpful in the short term, but some of these reassurance strategies can be quite unhelpful in the long term because they maintain the anxiety. Okay, yeah. They can be helpful in the short term, but in the long term, it can be difficult. A friend of mine has it, and it is very hard for them in daily life. They struggle with explaining it to others and concentrating at work, and that can be distracting for others around themselves. Okay. Not pondering over and developing on waswasa, sort of cutting the thoughts right from the start. Okay, so that's interesting. To be content with imperfections in life and being good enough rather than perfect. I find it more difficult when a person showing OCD and religious issues would turn to social media for guidance. Okay, so that's an important point somebody made. So there's certain things that can make OCD more difficult. So, for example, if somebody's got a religious issue, searching on the internet and getting help via social media can definitely be something that makes it more difficult. And then we would consider this as uh, unhelpful reassurance and an unhelpful coping mechanism. And we would put that down under as like a counterproductive strategy in terms of supporting them. So some of these things in OCD can be helpful in the short term, but in some ways they can make the issue more bigger in the longer term. And particularly with OCD, and to unpick all this, it does really require some skilled professional support. Okay, yeah. Yeah, so Jazakallah for that. I will have to move on given the time. So there's some really good comments made here, and I will probably allude to some of these as we go on in the next bit of the presentation. Okay. So in Ihsan, when we're working with OCD, we're using an overall Islamic model of the self. So we might use modern therapy frameworks like cognitive behavior therapy. But so this is just a slide to remind us that an Islamic model of the self, it does support us to understand human experience, not just specific to Muslims, but other religious traditions also have a concept of waswasa as well. And uh, it can help support us to better understand some of these difficulties that people are having. So, for example, some difficulties people have is when they have negative thoughts and distressing thoughts. They feel that the thoughts are generated from themselves that can lead to significant guilt. But from a religious perspective, from an Islamic perspective, we can externalize that experience and refer to some of these thoughts as waswas of the shaitan. Obviously, even if they are waswas of the shaitan, there still would be cognitive strategies we can use to support us to challenge some of these thoughts and things that we're having. and we've talked a bit about sometimes in psychosis, people experience an external voice, not an OCD voice, an external voice, and and some people think of these external voices as being from jinn. So this is quite different from an OCD presentation. Interestingly, when I worked with people with psychosis, it was a non-Muslim patient, and but my supervisor I had on my psychosis placement when I was doing my doctorate. She also mentioned this. She said it's quite interesting that a lot of people who have psychosis or they actually find the external voice less distressing than the internal negative thoughts and that waswasa level, because the external thoughts they can experience them as the external voices they can conceptualize that as being separate from them, and so they don't have guilty feelings about them. But in comparison to the distressing thoughts, they found that to be different. Okay, yeah. So when people experience an anxiety or a distressing thoughts, Mufti Sab will talk a bit more about this in his presentation. But there's verses in the Quran and the Hadith of the Prophet ﷺ that talks about anxiety and it being a normal experience. So in therapy, one of the aspects of therapy is to support people to normalize some of these thoughts that they have. So in the Quran verse, وَلَنَبْلُوَنَّكُمْ بِشَيْءٍ مِّنَ الْخَوْفِ وَالْجُوعِ وَنَقْصٍ مِّنَ الْأَمْوَالِ وَالْأَنفُسِ وَالثَّمَرَاتِ وَبَشِّرِ الصَّابِرِينَ. Surely we will test you with a bit of fear and hunger and loss in wealth and lives and fruits, and give good tidings to the patient. So in this verse, Allah subhanahu wa ta'ala is reminding us that we are going to experience some of these hardships. And it mentions fear specifically in this verse, and that can be understood as being an anxiety difficulty for some of our patients. And there's a hadith, Ibn Abbas told how a man came to the Prophet sallallahu alaihi wasallam. So when we're normalizing these thoughts, it's important for us to remember that the Sahaba radiallahu anhum ajma'in, may Allah be pleased with them, when they came to the Prophet sallallahu alaihi wasallam, they also had these distressing thoughts. And we often get patients come to us and they cannot really tell us what the horrible thoughts are. And one of the therapeutic goals is to build a relationship and get them to say what the difficulty is. So some people might come and they might not be able to say that they're having kufr thoughts. They're just keeping it to themselves and they're really distressed. So this Sahabi came to the Prophet ﷺ and said, I have thoughts of such a nature that I would rather be reduced to charcoal than speak about them. So that's exactly how some of the patients we come they feel like this. And the Prophet ﷺ replied, praise be to God who has reduced the devil to no more than evil promptings. So praise be to Allah that was reduced the devil to no more than evil promptings. And Mufti Sahib will talk about this, but thoughts in their nature are not sinful. And a lot of us experience these difficult thoughts. Okay. So I'm not going to spend a lot of time on this, but sometimes when it can be unhelpful to when supporting people to mention specific Quran verses and Hadith, because they might be misunderstood out of context. And sometimes it's important for us to hold the general principles of these Hadith and Quran verses in mind and support somebody to understand these gradually as they go through therapy or as they're discussing it with you. So, for example, Islam is between hope and fear. After difficulty, there is ease. So you'd hold these concepts in mind and you'd support somebody to understand their difficulties, and you wouldn't necessarily give them specific Quranic verses, because sometimes when people are in distress, sometimes it can be too difficult for them, or they can't see how the Quran verse applies to them, or they might say something inappropriate in response to that. Okay. So what can we do to help ourselves or somebody's suffering with an OCD? So one of the things is one of occupation. So sometimes, for example, when I talked about Zaid earlier, so he came in and he was having some level of distressing thoughts, But when somebody has some levels of distressing thoughts or some OCD type thoughts or behaviors, sometimes they can start avoiding people and they can do less and less. And when somebody's doing less and less, they're spending more time thinking about things, particularly in a sort of cognitive age where a lot of people have access to lots of information. For example, the brother sister who mentioned about social media. So if somebody's got waswasa about kufr, they can end up on social media and or search the internet, and then that can make it worse. So we need to look at occupation. So the idle mind is the handiwork of Satan, the sort of famous in English saying. So this is really important. So in some ways, we would focus on supporting the person or ourselves to engage in other activities. So the sunnah sports or the going out, seeing people. So looking at occupation is very important. Interestingly, there's a, a book by Abu Zayd al-Balkhi. It's called The Sustenance of the Soul, and he was a 9th century physician. And and the book is translated by the late Malik Badri, rahmatullah alayhi, who's quite big in the field of Islamic psychology, and he's passed away now. But he's translated the book, and it's quite interesting because in that book he talks about an OCD presentation, and he talks about the importance of increasing activity and occupation. So that's really important. The other thing in OCD is that, or waswasa, is sometimes some religious interventions can be misunderstood and they could be repetitively done in an unhelpful manner. So, for example, for waswasa, uh, one of the intervention is for us to recite ta'awudh, a'udhu billahi minash shaitanir rajim, or with an addition, which I'll show you in the next slide. So to recite a'udhu billahi minash shaitanir rajim. But when somebody is experiencing waswasa, they should, or these distressing thoughts, they should only recite this once and that's it. So sometimes people can then just constantly just recite ta'awudh or the Qul huwallahu ahad, Qul a'udhu birabbil falaq, Qul a'udhu birabbin nas in response to their distressing thoughts. So the person, they need to do it at the specified time. So the recitation of Qul huwallahu ahad, Qul a'udhu birabbil falaq, Qul a'udhu birabbin nas, which I'll refer to further on in the is supposed to be done at a specific time, not constantly in response to this waswasa. The other thing to mention is diets can have a big impact on our mental health. So obviously this is recognized in Western medicine, but particularly in if you talk to the herbalist or uh, people who practice alternative medicine, there's a concept of hot and cold foods. So for people with an OCD presentation, having a lot of hot foods is quite unhelpful. So for example, having nuts, chicken, and dates are hot foods. So these can add to people's anxiety levels. So eating more vegetables, reducing chicken is probably something that we all could actually do with, but it could be particularly more pertinent for somebody with an OCD presentation. Increasing exercise, staying in a city is sometimes correlated with certain mental health conditions, for example, psychosis, and particularly with OCD as well, this avoidance and this sort of cognitive focus in the person is can be quite helpful. So, and the other thing to mention is that when we are working with people, it can get quite difficult. So we should be careful not to mention stop thinking about it to people. Okay, so that can be quite helpful, quite unhelpful to say stop thinking about it. Yeah, so as I mentioned, so this is mentioned in Muslim when shaitan places doubts regarding one's faith. So, A'udhu billahi minash shaitanir rajim, amantu billah. Okay, so I just seek refuge in Allah from shaitan, the accursed. I believe in Allah. So this is quite simple, and when I give somebody an intervention, I try to keep it simple so they don't actually need to remember much. So even if they recited the A'udhu Billahi Minash Shaitanir Rajeem, so just to get support people to get into the habit of using these strategies and just once. So this is it's in the reference as well. It's from the du'as for beginners by Sheikh Mufti Saif Islam has this dua within it as well. So that's why it's got the number 36 on it. Okay, I am conscious of time, but to explore one of the things that I mentioned, I want you to try for let's do 1 minute because I think I'm going to have a time check at some point. So I just for 1 minute, which actually it sometimes feels like a long time, I want you to try your best for the next minute to try your very best not to think of a pink elephant. Okay, so I'm going to start now. Okay. First half, but I needed to do another task. It was a little difficult. The elephant kept showing up in my mind. Had to distract. I have to recite salawat to not think of it. Tried to think about other things, but found it difficult. So somebody tried to focus on me, so they tried strategies. Okay, yeah. Okay, somebody thought about a cheetah instead of an elephant. Okay, yeah. So yeah, so that's interesting. So some people said it went well. They managed it for a minute. Yeah. So I mean, the general purpose of this is when people are having distressing thoughts, it can be quite easy for us to mention that, okay, don't think about it and these type of things. But it can actually be quite difficult when somebody tries to stop thinking about something. It tends to be something that then makes it more difficult for them to stop thinking about. And I think, and sometimes some of the strategies that people employ, they might be helpful in the short term, but like for example, thinking about a cheetah, but it still doesn't solve the problem, and it can add to the problem because then the thinking of the cheetah becomes the alternative mechanism to manage the anxiety, and then becomes an unhelpful strategy. So I think one of the things I would probably say is probably not helpful to mention to people to stop thinking. What is sometimes at a sort of general level is probably to support somebody to do another activity and do these. Therapeutically, there's some strategies that we might use to support, like what we call cognitive diffusion, but some of that's a lot more complicated to support somebody to do, and probably not helpful to go through this as part of this webinar. Okay, yes. So we are talking about the fiqh of waswasa. So some people do struggle with waswasa during salah. So, for example, uh, I remember when I was younger, I think Mufti Saif Islam, our teacher and sheikh, he mentioned that if you learn new surahs and practice them in salah, it can support you to focus more better in salah. For example, so that can be quite helpful. Uh, when we're working with people with OCD, one of the things we need to look at is their sort of social life in the real world and in the digital world. Because the reality is, people's social life is in the digital world, as much as some people of a certain age might disagree with that, and how some of it's unhelpful from an Islamic perspective as well, and a mental health perspective. But that's the reality we work with. So sometimes people are using the internet unhelpfully. So, say for example, somebody's unsure if their namaz is accepted, they might search for the ruling on the internet, which can be unhelpful. One of the things about a fatwa is probably for a mufti to mention is that sometimes a fatwa is actually a personal ruling for a particular person, and it doesn't necessarily apply to some other people, and sometimes it can be taken out of context. And the person giving the ruling, he looks at the whole situation about the person. So if somebody came to Mufti Abdul Wahid, if he gets a sense that this might be a mental health problem, and we've had many discussions about particular patients, he might not actually give that person a ruling because it's unhelpful, because that person delving into rulings that are actually unhelpful for the person. The other thing, from a community perspective, one of the reasons why, for example, people might have difficulties with OCD and wudu, for example, is that they do not know the basic fiqh with regards to uh, praying and doing wudu. So, for example, we had a patient I supervised, one of my colleagues in Isan, and they had quite a strong waswasa during wudu, and they would repeat their wudu, and it would take them hours. And then, basically, through supervision, we taught them the fard of the wudu, the four fard of the wudu, and after that, the OCD with regards to wudu went down to a negligible amount, to like 10 minutes, and it wasn't a focus of intervention. And also, Mufti will talk about rulings in relation to managing doubt. So sometimes in OCD presentations, if people just study some basic level of fiqh, so for example, I do a Sunday class, adults come for a couple of hours a week, and if they come for a couple of years, they would learn the basic the rules and regulations. So this can be helpful. Also, from a community perspective, the amount of water we use for wudu is ridiculous. The actual amount is supposed to be like 750 milliliters, or if you just use a 1 liter jug. So that's what we should be using. So if we all just did wudu from a 1 liter measuring jug, or from you can get a calculation of 1 mud, for example. Or so if you, for example, if you go to holiday in Morocco, when you go to do wudu, they give you a little cup of water, and it looks impossible to do wudu from that. So there's certain things that might make it actually more difficult, that we might suffer these. Okay. And for some people, we might actually need to stop them from studying fiqh or studying atheism because of their difficulties. Okay. So one of the basic interventions is for us to do our evidence-based recitations to protect us from waswasa. So the recitation of the Mu'awwidhatayn, Qul huwallahu ahad, Qul a'udhu bi falaq, Qul a'udhu bin nas, is referred to as the Mu'awwidhatayn. But in this particular hadith, it mentions recitation of Qul huwallahu ahad, Qul a'udhu bi falaq, Qul a'udhu bin nas in these two narrations. So one is to recite after every salah. A number of times is mentioned in that hadith, and the other one's to mention before one goes to sleep. Obviously, when you work in the Muslim population, not everybody is reading their salah regularly as well. So therefore, I tend to give the more simple intervention. So just reciting them at night thrice and blowing over oneself. And also, not enough time to go into it, but recitation of the Durood Sharif is quite important for supporting people, particularly who have got like an anxiety sort of disorder. So the recitation of salutation of the Prophet ﷺ has a calming effect. So that's also quite helpful. So when working with or supporting somebody with OCD, or if you have OCD, it can be something that's quite difficult to manage oneself. So there are actually lots of self-help books available. So there's one over here I've got here, Overcoming Obsessive Compulsive Disorder, which I've referenced, and there's an Islamic workbook for religious OCD by Human Kashar Badazi and Samar Harfi from the Khalil Center in America, which is really helpful. But it is something that's difficult to manage them oneself. And sometimes to support somebody, particularly with the religious OCD, there needs to be some working together with religious professionals and mental health professionals, because the CBT therapist or the clinical psychologist might not have a good understanding of the Sharia. So even in Ihsan, alhamdulillah, we have a better understanding of Sharia, but even then, with certain situations, we might need specialist support. So to give an example, I had a patient who had a waswasa of divorcing their wife, and so basically we had a conversation with a learned scholar that he knew very well, and the Mufti Sahib gave him the personal fatwa that if, for example, out of distress, he actually did say talaq to his wife because of his OCD diagnosis, that I explained to Mufti Saab, then that talaq would be invalid. So that's a personal fatwa. I'm going to talk a bit about cognitive behavior therapy because some psychological therapies can be quite unhelpful when working with OCD because they can lead to an increase in reassurance. And cognitive behavior therapy, in some ways, supports people to address their fears. But some people can find it quite difficult to work in this way because to get better, in some ways, you have to feel more anxious. So some people's their anxiety levels are so high that we need to use other strategies, and that could be via herbal medication or via medication via the doctor or the psychiatrist to reduce their overall levels of anxiety so they can engage in psychological therapy. Next slide, Mukhtisar. Oh, so CBT and anxiety. Cognitive behavior therapy, there's some reference there for the NICE guidelines for OCD. So NICE is a government body, an external government body with some independence that looks at the research evidence for particular interventions and the effectiveness of these interventions. And for many OCD, for many anxiety disorders, they recommend cognitive behavior therapy. Certainly, as a clinical psychologist and Ihsan, as I mentioned before, CBT focusing on anxiety might not actually be the issue for that particular patient. You might want to work on the depression. But if you're working on the OCD more purely, cognitive behavior therapy is quite helpful. And some of the strategies in cognitive behavior therapy, for example, exposure and response prevention, is consistent with fiqh rulings. For example, Mufti Saab is going to talk about praying salah and carrying on praying salah regardless of your anxiety and regardless of your doubts. So some of the fiqh rulings are very consistent with cognitive behavior therapy. So this is quite a helpful therapy. So as part of Ihsan, we offer cognitive behavior therapy within an Islamic model of the self to support people with anxiety, such as OCD. So the next slide, I think just a couple more slides and I'm going to finish off. Okay, so in terms of getting help for OCD, so this cognitive behavior therapy, it's available on the NHS. So people are joining the webinar in England and Wales. I'm not sure about Scotland and Northern Ireland. They have different bodies, but they generally look at the same level of evidence. So cognitive behavior therapy is quite helpful for this presentation. So if somebody had this difficulty, they could go to their GP and get referred to a mental health service, or they could self-refer to their local mental health service, and they could get this support for their OCD. Obviously, when you're meeting a therapist, it could even be a Muslim therapist in the NHS, they might not have a good understanding of religion or find it quite difficult. So in Ihsan, one of the things we do, we offer a one-off consultation appointment to the therapist to support people to understand the religious aspect of that therapy. So we offer that as part of Ihsan. So in Ihsan, where we offer a specialist psychological therapy, we are an affordable paid service. So if you go on our website, you can make a self-referral, or you can point somebody towards the right direction in terms of support. Also, in Ihsan Therapeutic Service, we don't only provide a specialist psychological therapy, we're a community psychology service. We offer teaching, training, and research. If you look at the Al Balag website, we offer a level 1 Islamic psychology and counseling to support people like yourselves that might be supporting other people in the community with mental health difficulties. And we do community events and health promotion, for example, like this webinar that we're doing today. So you could self-refer or via a professional. So you just go to our website, all the details are there. So but an adapted cognitive behavior therapy within an Islamic model itself is very efficacious in supporting people with OCD. But as we know, OCD is quite a complex presentation. But one of the first things we need to do work out, is OCD the main issue? and are these difficulties that's presenting, are they an OCD? And sometimes by doing the basic community level intervention, by teaching people basic fiqh and giving people reassurance, sometimes that can be enough to move people forwards. Okay, inshallah. Next slide. Okay, so inshallah, Jazakallah, I've just run over a bit. So over there, I've mentioned Abu Zayd al-Balkhi's Sustenance of the Soul book mentioned there. There's a reference for DSM. There's a reference for a couple of these self-help guides. As I mentioned, they can be helpful for some low-level psychological difficulties, but often in a clinical presentation, it can be quite difficult. And there's some CBT self-help books and resources that I have mentioned there. And there's a reference for the Dua for Beginners by Sheikh Mufti Saif al-Islam for duas that you can look at, inshallah.